Let's talk about the true cost of Canada's so-called free healthcare. And I don't mean what it costs the government. I mean what it's actually costing you, the people who try to use the healthcare system, in time, in money, in health, and in your ability to live your life without pain, stress, or financial ruin. According to a new Fraser Institute report, in 2024 alone, 1,543,994 Canadians were stuck waiting for medically necessary care. That's nearly 4% of the entire country. About the population of Manitoba, trapped in diagnostic and treatment limbo. The average Canadian waiting for surgery or a specialist appointment lost $3,364 in income last year alone. That's the conservative estimate based on standard work hours, 9 to 5, Monday to Friday. But if you count evenings and weekends and every waking moment lost while waiting in pain or reduced capacity, the real number balloons to $10,266 per person. And the total economic cost to Canadians, $15.9 billion. That's more than the entire annual budgets of Veterans Affairs, Public Safety, or the RCMP. And this isn't for elective procedures. These are for medically necessary services, hip replacements, cancer diagnostics, cardiovascular surgeries, things that determine whether people suffer, heal, or die. For some context, in 2023, the average wait time from GP referral to treatment in Canada was 27.7 weeks. In 1993, that number was 9.3 weeks. More money, longer wait times. In Nova Scotia, the wait time is a horrifying 56.7 weeks. The OECD average for similar care, about 8 weeks. This is a catastrophe. And yet Canadians are paying more than almost anyone else in the developed world for this disgrace of a healthcare system. We spent $344 billion on healthcare in 2023, or 13.1% of the GDP. That's $8,563 per person. And for what? To be told to wait, or worse, take a number and hope the number doesn't outlive you. Now, here's the part that should chill you to your bones. While you're stuck waiting, the government's offering a faster alternative: death. That's right. If you wait long enough, suffer hard enough, and can't afford to live without treatment, well, there's always MAID, medical assistance in dying, and that is booming. That's fast healthcare. MAID is now among the top 10 causes of death in Canada. In 2023, over 13,000 people ended their lives with the government's help, many citing lack of access to care, housing, or even food as contributing reasons. So while you wait in pain for surgery that never comes, the same health system that can't book your MRI is more than happy to book your death. That's not compassion. That's a system giving up on you because it's cheaper. Let's not forget, this Fraser report only measures lost wages for the person in the queue. It doesn't count family members who miss work to provide care, mental anguish or emotional strain from delayed diagnoses, increased risk of complications or death from those delays. This is not universal care. It's universal suffering. But Ottawa's response: more bureaucratic band-aids, more DEI consultants, more scolding provinces for daring to try to reform this broken system. And while Canadians are forced to hold bake sales to afford private treatment abroad, our ruling class jets off to the Mayo Clinic or skips the line entirely with a wink and a phone call. It's time to end the monopoly. It's time to let provinces fund healthcare in better ways. It's time to give Canadians a choice other than pain and poverty. Because if you're still calling this system free, you must be talking about the government, because the rest of us are paying for it with our health, our income, and sometimes our lives. And when the wait lists get too long, the state has a syringe with your name on it. For Rebel News, I'm Sheila Gunn Reid. Canadians love to brag about our so-called free healthcare system, but it costs Canadians more than just $8,000 per year for a system we can't even use. For many of us, it will cost us our lives. To sign our petition and to demand change, go to helpnothomicide.com.